Good morning, I'm Fauzi Maluf Filho, Associate Editor for Gastrointestinal Endoscopy, and today I have the honor to interview Dr. Vipul Jairath from the Department of Medicine, Epidemiology and Biostatistics, University of Western Ontario, Ontario, Canada. Dr. Jairath has recently published his research entitled Reliability Among Central Readers in the Evaluation of Endoscopic Disease Activity in Pouchitis. Vipul, thank you for coming.
Thank you. Thank you for having me.
Vipul, your research deals with the creation of a new index for the evaluation of endoscopic disease activity in pouchitis. Why do we need a new index for evaluation of pouchitis activity, considering that pouchitis disease activity index is available?
Great. Well, thank you for opportunity to present this research today. So,
Absolutely.
I think maybe if we just track back about the issue of pouchitis, so we know that about 15 to 20% of patients with ulcerative colitis will need a colectomy at some point in their disease course, and the surgery of choice in that situation is a restorative proctocolectomy and ileoanal pouch formation. Unfortunately, about 50% of patients during their lifetime then develop pouchitis, and many of those go on to develop chronic pouchitis. And unfortunately, that leads to really quite impaired quality of life, because many of those patients become dependent upon chronic antibiotic treatment, and fundamentally there's no approved treatment for pouchitis. So there's really a need for new therapies, and there are a couple of drugs under development at this stage. Now, in order to develop new therapies for pouchitis, it's essential that the evaluative indices that we use to actually measure the disease are fit for purpose. And so that led us to conduct this research, really focusing on evaluation of endoscopic disease activity only. Now, you mentioned the pouchitis disease activity score, and that's the gold standard score for measuring pouchitis, and it has the classic triad of symptoms, histopathology and endoscopy. The way some of these indices were developed are not by the same methods that a regulatory authority would need to evaluate a new drug treatment, for example. And I think symptoms in patients with pouchitis can be influenced by many other things, such as strictures or incapacity and other aspects. So really our view was that the most objective measure of disease activity was probably endoscopy, because it's something you can see and evaluate before and after therapy. So we really wanted to focus purely on the assessment of endoscopic disease activity, with the aim of potentially creating a new evaluative index.
Thank you. And could you comment on the design of your research?
Sure. So the first step that we did, this was a reliability study, but the first step that we did was to go and do an extensive literature review to look at all the existing indices that are there for pouchitis disease activity, and then look at the endoscopic components of those and see what items were already available within measuring endoscopic activity. And that literature search revealed 5 different indices over many years. And many of the items were common to those indices, so it was the classical things that you might expect: ulceration, erosions, granularity, edema, friability, bleeding. So no major surprises, but there were several indices. We then took those items and we convened a panel of global experts, which were gastroenterologists who were experienced in managing patients with pouchitis, surgeons and methodologists as well. And we presented those items, and also through a consensus process asked the experts to list any other items that they think should be measured when you evaluate endoscopic activity in a pouch. So just what's called face validity: is there really anything else other than this list of 10 items we've identified that you think should potentially be evaluated in a pouch? And that exercise led to 17 different items being generated that you might possibly evaluate in a pouch. And it looked at all aspects, from the cuff to the pouch body to the ileal pouch anastomosis to the pre-pouch ileum as well. And then we went through a process of then voting on the appropriateness of those items.
And then this, do you imply the methodology named RAND appropriateness, right?
Yeah. So the study then went, after the systematic review, through 2 processes. One is a voting through RAND appropriateness methodology, and then we actually embarked upon reading of the videos through a reliability exercise. And what RAND methodology is, it's been around for about over 30 years. It's like a modified Delphi process. And the background to RAND methodology was the sense that in clinical medicine, we'll never have a high-grade evidence or a randomised trial to tell us the answer for every single question that we have of interest. So, gauging clinical expert opinion and asking clinicians to vote in a process of whether they think a certain intervention or procedure is appropriate or inappropriate. So the voting process for this took the endoscopic items, and the panellists were asked to vote whether they thought it was appropriate to include these in an evaluative index for pouchitis or inappropriate. And it's ranked on a scale of 1 to 9. And at the end point of all of that is that items will either be, the panellists are certain they should be included, certain they should not be included, or they're uncertain, and many times you end up with grey areas of uncertainty.
Okay, and which were the endoscopic items that the panel of experts found appropriate?
Yeah, so there were a number of items that they thought that were appropriate, and in the list of 17 there were at least 10 items that they thought were appropriate and others that were uncertain, and just 1 or 2 inappropriate. But the general approach is, for the next step of the study, which was to take blinded central readers to then evaluate those videos and those items. So 50 videos were then taken of patients that were collected in routine clinical care with pouchitis, with a variety of disease activity states. And 3 central readers who were totally blinded to all clinical information on the patients then had to go through and score all of those videos and score every single item that had been identified. And when you're going through the process of index development, the idea is to be very broad, and even if the panellists were uncertain whether the item should be included, the idea is really to put all of the items in and then look at reliability, because you might think something doesn't perform well, but it may actually perform well when it's read independently. So the idea behind the different readers was then to score these items independently, and then statistically we're interested in 2 things related to agreement.
Yeah.
One was intra-rater agreement and one was inter-rater agreement. And intra-rater agreement is how well you agree with yourself. So each reader read each video 3 times, 2 weeks apart. And then inter-agreement is how well the readers agreed with one another when they're scoring these items independently. And what we always see with index development is that you agree with yourself over and over again better than you agree with other people. And often it's an issue of just differences in the way terms are interpreted by different readers.
Thank you. And how was the inter-readers agreement?
Yeah. So I think we were slightly surprised overall that the vast majority of items did not have substantial agreement. So when you're evaluating endoscopic items, you'd like to see inter-rater agreements at least above 0.6, which is thought of as substantial. Ideally, you'd want to see even higher than that, 0.7 or 0.8 inter-rater agreement. And that's the sort of level that you'd want to see whether you're looking at a histopathology slide, an MRI image, or an endoscopic image. Only 2 items came out with agreement at the level that we would at least expect. And 1 item was already available in existing indices such as the PDAI, and that was ulceration. And the second item that came up was an additional item that the panellists had come up, and that was percentage of the surface area of the body of the pouch covered with ulcers. So again, it was all related to ulceration. And for ulceration, the inter-rater agreement was around about 0.68, and for percentage of the body covered with ulcers was 0.72. So those 2 items had the most substantial agreement. Many of the other items were in the range of 0.4 to 0.5 in terms of their inter-rater agreement, which really isn't good enough to be in an evaluative index. And some things were even poorer than that.
And Vipul, which are the future directions of your research? Yeah,
so I think when the process of index development first involves, looking at agreement that we've done now, and the 2 best items, ulceration, percentage of the body surface is ulcerated. The next step is really to assess responsiveness of the items, and what responsiveness means is if you give a treatment to the patient that works for pouchitis, which of those items actually improve. So the next step is taking a group of patients who are treated with therapies. We measure all of those items at baseline, or certainly the ones where there was reasonable agreement, and then we look afterwards in the same process to see which items actually changed. And it may well be that we need a much more simple evaluative tool, and it may be that the only thing that really matters in a pouch is ulceration, and many of those other items that are difficult to measure in small bowel mucosa, such as edema and granularity, just aren't important. So next stage is responsiveness, and from there we hope to develop and create a simplified index, and ultimately we hope that index will be used in drug development. Pouchitis has been given orphan designation by regulatory authorities such as the FDA to develop new therapies. There's a huge area of unmet need, and we hope that the creation of an index will aid better therapies for patients in the future.
Thank you so much, Vipul, and once again, congratulations on this nice publication.
Thank you very much.
Thank you.